Hello everyone, it's Spence, VP of Sales and Marketing for Meridian Medical USA. And I'm here at the 2025 AAO convention in Orlando, Florida. And I'm here with Jojy Schless of the Geneva Eye Clinic. Tell us about your story and about your practice.
Sure, we got introduced to your product because you were talking to us about, do you have two separate lasers? Do you know that there's a combo machine out there? And so we started that discussion, and then you volunteered to bring the device into our office.
Obviously, you had two very old lasers. You had the Solo YAG laser and the Solo SLT laser. When you think about updating your practice and some of your equipment, how important is that to not just your practice, but other practices in the area in general?
I think the opportunity came about because you asked about it. You have two machines, would you ever consider it? And it was a great way to initiate the conversation because we were able to look at, we're running out of space. So now we have two rooms dedicated for these two different devices, and the possibility of being able to get a newer machine and have it in one location, I think was really a game changer for us. And so I think it was genius to have a trial period where we could have each of the doctors get on the machine. We did a little bit of changes with our template so that the SLT and the YAG patients were really scheduled for the days that you were going to be here with your machine. And so it really was a great opportunity to get hands-on, just experientially, get to see the device, get the patient's reactions, just be able to use it and understand in a very tactile fashion, what was going to be the benefits of this new combo laser. I didn't realize, to be honest with you, until I talked to the doctors about how much they like this device, that they pay attention to a lot of things that had never even occurred to me. Dr. Hawkins talked about the ability to see the bubbles. She talked about, both her and Dr. Katherine Brito spoke about the decrease in energy that they're using on a patient. To be able to get the same outcome or better outcome with less energy use seemed to be a really important factor for both physicians. Plus also, I think having all of our diagnostic equipment in one area also allows us to create less confusion about where the patient is supposed to go and to be taken, because now we have one room with two devices. From a setup and delivery standpoint, you were very, very helpful to us to talk us through the timeline of being able to know when is this going to arrive, how is it going to be set up, even to the point of having somebody locally be involved with us so that if we had an urgent issue, we'd have somebody locally to help us. The other thing that they love about this machine I want to talk about is that Dr. Katherine Brito just talked about how easy it is to use the machine. It's really something that you can get used to and start using right away, but I think there's a high level of comfort for each of our physicians with this particular device. So I think it's been, clinically, very helpful to them, as well as logistically, it's been very helpful. I think from a physician satisfaction standpoint, a template and usage and space standpoint, all of these things have really delighted us, and we are so thrilled to have this new device at Geneva Eye Clinic.
Jojy, it has been an absolute delight having you visit here at the Meridian booth for AAO and spending time with us. Yes. Thanks a lot for all the kind words, and it's been an absolute delight working with you and your team, Dr. Hawkins, and all the rest of our colleagues at Geneva Eye Clinic. Thanks so much, and we'll be checking with you soon.
Thank you so much.
You bet.